All set?
Yes.
Okay, thank you. So I want to thank you all for coming this afternoon. Good afternoon. This is the informational session to discuss the request for proposals to develop, design, and create a mobile application and website for parents and caregivers to address mental health challenges of children and adolescents. And this is RFP number 2022-027VF. My name is Amy Rockwood. I am the Director of Planning and Evaluation for the Erie County Department of Mental Health. And Melissa Stark, who is our contract technician, is also on the call. And if you would please put in a chat to her your name, email address, and the organization that you're with so we can keep a roster of who attended today. That would be very helpful. Anyone that's listed on that list and who has responded to this RFP will receive a notification when the answers to any of the questions that have submitted are posted, with a link to where those are found. And if you do not get that, you can also just go back to the website where you found the RFP on the Erie County Department of Mental Health webpage. You'll be able to find those there. Our expectation is to post the answers on Wednesday or by Wednesday. Please keep your microphones muted. And here we go. So any information discussed in this session is intended to support what is provided in the request for proposal. You should refer back to the request for proposal for clarification, additional details, and the complete requirements. The intent of this session is to provide information related to this request for proposals, provide important information regarding the application requirements, review the timeline and schedule. This session is being recorded and will be posted to the Erie County Department of Mental Health website listed here by Wednesday, June 15th. So as an introduction to the proposal, the Erie County Department of Mental Health is currently seeking proposals to develop, design, and create a mobile application and website to help parents and guardians navigate the behavioral health systems of care for their children, as well as provide information about common behavioral health and mental health conditions. The project has two components: development and design, and number two, application and website development. Applicants must be able to perform both components and must demonstrate the experience and qualifications to successfully complete the project for a launch date of January 2nd, 2023. Proposals may involve two or more vendors, with one proposer being named as the lead. To clarify, that means that a web developer, an app vendor can partner with a mental health or behavioral health expert to create this proposal and submit a single proposal with one of those entities being named as the lead. The need that this project seeks to address is that mental and behavioral health challenges were getting worse for children and adolescents before COVID-19, and the impacts of the pandemic made everything worse. Children and families have faced a myriad of challenges over the past 2 years, including social isolation, financial hardship, grief and loss, academic struggles, and a disruption of their lives from what they knew before the pandemic. Marginalized communities, including communities of color, LGBTQAI+, youth with disabilities, and the poor, suffered mental health disparities before the pandemic, with those disparities exacerbated as a result. Parents and educators report that children are dealing with increased anxiety and depression, school violence and safety concerns, increased stress at home, unstable housing, and increased homelessness, and greater financial stressors. And I would add that the recent events that have happened in our community have made all of those things even worse. So there are a couple of project components, and we are looking for a proposer who is able to lead and coordinate all aspects of this project. Proposers may partner with other organizations to complete the work, but one organization must serve as the lead. Project components include development and design, mobile application and website development, and the additional requirements, which I will go over momentarily. The development and design is really about the content that will be included on the app and website. Community input from parents, guardians, schools, and organizations that serve children and families with behavioral and mental health challenges is required for this project. Community input needs to be from diverse communities, including communities of color, LGBTQAI+, youth, and youth with disabilities, rural, urban, and people living in poverty. Community input will help identify the needs, content, functionality, and design of the mobile app and website to be developed. This is an aside, but in our preparation, in preparing this RFP, there were conversations and groups identified that are very interested in being part of these conversations, and that information will be shared with the selected vendor, so you won't be starting from scratch. The mobile application and website development. Both a mobile application and a website must be developed. The mobile app and website will need to provide information, access to resources, be user-friendly and intuitive. The mobile app and website should be able to be updated in a single interface. Ongoing maintenance and support costs should be minimal, and the selected platform should allow for future expansion of the content. And please see the complete list on page 9 of the RFP about what is required. Additional requirements: the proposer will meet with the Erie County Steering Committee to identify and select content and resources to include, prioritize the content and functionality of the final product, and organize the materials within the mobile app and website. Prior to launch, the proposer must test the mobile app and website to ensure that it operates as designed. This should include some end users, parents and guardians, school personnel, and providers of mental health services for children and adolescents to test both the mobile app and web-based interface. The note on this is we will likely have one opportunity to present the mobile app and website to users, and if it fails or does not work as intended, we won't get them back. It's important that we're able to engage the folks that we're hoping to with this app and website. We're also asking that the proposer be available for up to 80 hours post-launch through July 2023 to provide support, consultation, and revisions if needed. This would be during normal business hours and should be calculated within the allocation and the amount of the award for this proposal. Funding: a maximum of $100,000 is available for the requested development, design, and creation of the mobile application and website to help parents and guardians navigate the behavioral health systems of care for their children, as well as provide information about prevalent behavioral health and mental health conditions. The county seeks to minimize future and ongoing costs beyond this award, and the proposer will need to provide an estimate of ongoing maintenance and support expenses for future years in the proposal. Future funding has not been identified, is not guaranteed, and will be dependent on available funds and subject to the demonstrated performance of the selected applicant agency, as well as their meeting all of the Erie County Department of Mental Health requirements. The proposal requirements are listed in the RFP submission package checklist on page 12 of the RFP, and that includes the RFP submission package checklist, application cover page, proposal narrative, which is not to exceed 10 pages, the work plan and timeline, which is not to exceed 3 pages, budget and future costs template, letters of recommendation, letter disclosing employees or officers who are current or recent employees or officers of Erie County, the proposer certificate form, the County of Erie Equal Pay Certification, and a minority-based and women-based letter as described in the proposal. Important information to know, and that I would highly suggest that you consider as you're developing your proposals. Read the entire request for proposals, include all of the required documents, and package your proposal materials in the same order as listed on the checklist, and label each item with the same name as listed on the checklist. Appendix C, the scoring tool, is a really good guide to follow for the preparation of your proposal. Everything you need to know and how each one of the proposals will be rated is listed in the scoring tool. Selection of the proposer to receive the contract will be based primarily on the scores as identified in the scoring tool. Review the scoring tool and provide the information we're asking for in order to get the best possible score on your proposal. The RFP schedule, it was released on June 6th, 2022. Informational meeting is now April 13th. Written questions are due today, April 13th at 5 p.m. They are due by email, and I will go over that in one moment. So if you have questions that you'd like to share with us, that you would like answers to, please send them to Melissa Stark. I will go over that on the next slide. The responses to those questions are intended to have them all posted on Wednesday, June 15th, 2022. The proposal deadline is June 27th, 2022 at 3 p.m. Selection is to be made on or about July 8th, 2022. And the website and app is to launch on January 2nd, 2023. Regarding the written questions, the written questions should be sent by email to melissa.stark@erie.gov. All questions need to be received no later than June 13th, 2022 at 5 p.m. Be sure to include question-RFP number 2022-027VF as the subject line in your email. Only questions received by email by June 13th, 2022 by 5 p.m. with the above reference subject line will receive a response. No individual responses will be sent in response to emailed questions. Responses to RFP questions received by email by the deadline will be posted on the Erie County Department of Mental Health website on or about June 15th, 2022. And the website is listed here. I do want to provide a caveat here. If there are questions that I need to seek answers to from other people, and I'm not able to get those answers by June 15th, there will be a note in the document that's posted, and those questions will be added as soon as I have the answers. Submitting your proposal. All proposals must be delivered to the Erie County Department of Mental Health by June 24th, 2022 at 3 p.m. We're on the 12th floor of the Rath Building, which is 95 Franklin, Buffalo, New York. And you can hand deliver those proposals to us or by messenger. Please give yourself enough time to get through security and come up. Proposals received after the above date and time will not be considered. Absolutely no exceptions will be made. Proposals are to be packaged and ordered as listed on the checklist, and we will need 1 original and 6 hard copies, and they should be submitted in a sealed package. Please print single-sided and do not staple your proposals. Some suggestions: read the request for proposals in full, follow the instructions, try to make it easy for the reviewers to find the information for each section, use clear, easy to understand language, and be sure to get your proposal to the Erie County Department of Mental Health before the deadline, or it will not be considered. Before I say thank you, I did want to mention that the content for the web and application will be largely driven by the community meetings and the input you receive there, as well as input from the Erie County Steering Committee. Much of that content is available already through other sites and through other, primarily websites, that the Erie County Department of Mental Health has been involved with. It could also be coming from state or US government sites, things of that nature. So I want to say thank you. Thank you for your interest in this request for proposals. If you have any questions, you have until 5 p.m. today to submit them by email to melissa.stark@erie.gov with the subject question-RFP number 2022-027VF. We look forward to receiving your proposals. I am going to end the slideshow. And I would ask at this time, if you have not already, please in the chat, send a note to Melissa with your name, email address, and your organization, so we can keep you on the roster and make sure that you receive the information about the questions when they are posted. Also, this meeting has been recorded and will also be posted on that same webpage. And I think that's it. Did I miss anything, Melissa?
No, Amy, you're very clear. However, I do have a chat message if anybody is allowed to ask questions during this meeting. If you'd like to
For
answer
the
that.
sake of being prudent and fair to everyone, I would recommend that you email your questions to Melissa, and we will be releasing all of those by Wednesday. If they're not all able to be answered by Wednesday, I again will leave a note in the document that's posted, and you should check back to that site. Okay. Thank you all for being here. Thank you for your interest in this RFP.
Amy,
Yes.
Dominic's question is regarding to the due date for the questions today. Can you let him ask the question?
Sure.
Go ahead, Dominic. Put it in the chat. Can the question due date be extended till tomorrow? He'd like to discuss talking points from this meeting with his team, but with questions being due in 1 hour, we will not be able to ask refined questions.
Since this was already put into the RFP that they're due today at 5, I can't extend the deadline for questions. So ask the best questions you can by 5 p.m. and we'll be able to go from there. Thank you. Sorry. Okay. RFP responses are due the 27th. Did I misstate? Oh. That was an error on our part. So responses to the RFP are due on June 27th. That's a Monday at 3 o'clock. That one I can't answer. I apologize for the error. Okay. Well, thank you all and have a good day. Look forward to your questions. Look forward to your responses and look forward to potentially working with at least one of you in the future. Thank you.